Have you ever felt a sudden tightness in your chest and wondered, is this a heart attack or just indigestion? It's a question many of us ask, but the answer is not always so clear-cut. Heart disease is a leading cause of death worldwide, but surprisingly, many people mistake the symptoms of a heart attack for something much less serious, like acid reflux or gas. In this video, we'll explore the critical signs of a heart attack, the subtle differences between it and other chest discomforts, and how you can protect your heart. Understanding these symptoms and knowing when to act can be the difference between life and death. So, stay with us as we uncover the life-saving knowledge that could help you or a loved one. Heart attack vs chest pain. Understanding the critical signs and their importance. When we talk about cardiovascular health, we need to understand the symptoms that can often mimic one another but have vastly different underlying causes. One of the most important areas of focus is chest pain and heart attacks, both of which can present as discomfort in the chest but require different responses. Understanding the key differences between heart attack-related chest pain and pain from other causes, like indigestion or acid reflux, can be the difference between life and death. This is why it's so crucial to know what to look for and how to act. Heart attack symptoms. Recognizing the true warning signs. A heart attack is a severe, life-threatening event that occurs when the flow of oxygen-rich blood to a part of the heart muscle becomes blocked, often by plaque buildup in the coronary arteries. According to the American Heart Association, AHA, nearly 800,000 people in the U.S. suffer from heart attacks each year. The pain associated with a heart attack is often described as a pressure or tightness in the chest that feels like a heavy weight. In fact, one of the most commonly reported feelings is a sensation of oppressive pressure in the center of the chest, often described by patients as feeling like an elephant is sitting on their chest. What makes this pain particularly dangerous is its radiation. For example, the pain may not be limited to the chest alone. It often radiates to the left arm, jaw, neck, back, or shoulder. This spreading of pain is a hallmark symptom of a heart attack. Dr. Clyde Yancey, a renowned cardiologist and past president of the American College of Cardiology, has emphasized that chest pain that radiates to the jaw, neck, and back is one of the most important signs for identifying an impending heart attack. This is a crucial clue that shouldn't be ignored. Other symptoms that should raise immediate concern include shortness of breath. As the heart struggles to pump blood efficiently, oxygen supply to the body is diminished, causing difficulty in breathing. Cold sweats, often seen with heart attacks due to the body's stress response. Nausea and lightheadedness, these can accompany the chest pain, particularly in women, who often present with less typical symptoms compared to men. Dizziness or fainting, caused by decreased blood flow to the brain. This combination of chest pain and other symptoms, according to the AHA, requires immediate emergency intervention. Dr. Robert Harrington, a leader in cardiovascular medicine at Stanford University, asserts, time is muscle, meaning that the sooner treatment is provided, the more heart tissue can be saved from permanent damage. The role of digestive issues in chest pain. While chest pain is often linked with heart problems, we must also acknowledge that gastrointestinal (GI) issues can present with symptoms that mimic heart pain. This confusion arises because the esophagus, which is part of the digestive tract, is located near the heart. When individuals experience gastritis, acid reflux, or even gas bloating, They may feel discomfort or a burning sensation in the chest area, which is often mistaken for heart pain. The American College of Gastroenterology estimates that 1 in 5 Americans experiences heartburn or acid reflux at least once a week. Acid reflux is one of the most common causes of chest pain, and it occurs when stomach acid backs up into the esophagus. The pain caused by acid reflux often feels like a burning sensation in the chest, sometimes referred to as heartburn, which can be difficult to distinguish from the pain of a heart attack. However, unlike heart-related pain, acid reflux pain is often relieved by antacids or adjusting body position, for example, by sitting upright after eating. The pain may also worsen after consuming spicy foods, fatty foods, or caffeine, which can be a clear signal of a GI problem rather than a cardiac event. Furthermore, gastritis, esophageal spasms, and bloating can cause discomfort in the chest. The key distinction here is that the pain remains localized, rather than spreading to other areas of the body like the arm, jaw, or back. Research and insights from cardiovascular experts. The distinction between heart attack pain and gastric discomfort has been a subject of many studies and debates in the field of cardiovascular medicine. One study published in the Journal of the American College of Cardiology in 2018 found that nearly 50% of people with heart attack symptoms initially misdiagnose themselves or are misdiagnosed by others as having simple indigestion. The study emphasized the need for better awareness of the subtle signs of heart problems, particularly in people with no prior history of heart disease. According to Dr. Peter Libby, a leading cardiologist at Harvard Medical School, understanding the nuanced symptoms of a heart attack is crucial. In many cases, subtle symptoms are ignored, leading to delayed treatment. He further stresses that, while gastrointestinal issues can mimic heart attack symptoms, heart-related chest pain is usually more intense, lasts longer, and is not relieved by over-the-counter medications. This is an essential point for anyone who experiences unexplained chest pain. Real-life case study, a life-saving lesson. Consider the case of Paul, a 57-year-old man who had been experiencing intermittent chest pain for a few days. He assumed it was related to acid reflux, as he had a history of heartburn. However, the pain was more intense and seemed to last longer than usual. It wasn't relieved by his usual antacids, and he started feeling short of breath and dizzy. Thankfully, Paul decided to visit the emergency room. After tests and imaging, he was diagnosed with a severe blockage in one of his coronary arteries, which led to a mild heart attack. Paul's quick action and decision to seek help saved his life. This case is a reminder that heart attack symptoms may not always be obvious, and many people mistakenly ignore them, assuming they are due to digestive issues. If Paul had waited longer, his situation could have been far worse. The key takeaway here is that listening to your body and taking chest pain seriously is critical. Recognizing the symptoms and acting quickly. To summarize, here's how you can differentiate between heart-related chest pain and digestive issues. 1. Location and radiation of pain. Heart-related pain often starts in the chest and radiates to the left arm, neck, jaw, or back. If you experience this kind of radiating pain along with tightness in the chest, it's more likely to be heart-related. 2. Duration of pain. Pain from a heart attack lasts longer and doesn't go away with antacids or rest. It can last for several minutes or even longer. whereas pain from indigestion or reflux usually subsides after a short period or with medication. 3 accompanying symptoms: the presence of nausea, shortness of breath, sweating, and dizziness alongside chest pain is a strong indication of a potential heart attack. As gastrointestinal pain doesn't typically come with these symptoms. For relief with rest, if the pain decreases or resolves with rest or changes in posture, it's likely related to gastrointestinal issues like heartburn or gas. Heart attack pain, however, will not subside with rest and requires immediate medical intervention. In conclusion, chest pain is never something to ignore, and being able to differentiate between heart-related pain and digestive discomfort is vital. Timely medical intervention can make all the difference in heart health, and recognizing the warning signs early is your first line of defense. Remember, your heart health matters. By understanding the signs, acting quickly, and taking preventive steps, you can safeguard your heart for years to come. Share this video with your friends and family because when it comes to heart health, awareness truly can save lives. Let's take charge of our health and protect the hearts we hold dear.